myself to engage sister. Ya alif lam mim yalla shafi yalla mafil kafi ana abdul muhammad sur shafi mafi kafi. Now my friend was welcome to medical science class. As a student of medical science, I wanted to take flavor every branch of medical science. What kind of things say do that is bad, that is knowledge, that is real science, that is good one, that is out of the nothing yellow is down and computer except location last and best person. Lie the Muhammad. Now my friend was I'm herpes simplex herpes just a treatment bola. Now in morning what I say you know that. यूनिवर्स मल्टीवर्स क्रिएटर और क्रिएशन पाई का डॉक्यूमेंट है. आप तो जो देखा वो बिलीव करते हैं, जो नहीं देखा तो सस्पेशन और बिलीव नहीं करते हैं. नाउ माय फ्रेंड Buddha, last time I say last lecture I say that I say that is the reason I say sorry. My friend Buddha, sometimes I am also creation improvement. Angriness come, I say sorry all occasion and say sorry to one and make it real. Please forgive me, forgive us, blessing. Now medical science class. Medical science class, what is science? Science is anything, any matter, any event, any problem, any occurrence can solve by logic, document, mathematical calculation, with experiment, that is science. What is medical science? Medical science is the branch of science described about creation like human, homo sapiens, scientific name of human, homo sapiens. अभी हम देखता हूँ आप ब्रेन ट्रांसप्लांटेशन सर्जरी में हार्ट, लंग, लिवर, वो तो already know that. Now vocal cord, ENT the ear, nose, throat. थॉट में क्या होता है? ओरोपेरिंग्स, नेसोफेरिंग्स, लैरिंगोफेरिंग्स. लैरिंग्स ट्रैकिया, फेरिंग्स इसोफेगस. वो ट्रैकिया में शॉर्ट थ्रोट, कॉमन कॉज शॉर्ट थ्रोट. शॉर्ट थ्रोट का ट्रीटमेंट, व्हाट इज द ट्रीटमेंट ऑफ शॉर्ट थ्रोट? Short throat, there is the treatment protocol of short throat. You know that. There is a treatment protocol of short throat. What is the treatment protocol? If fever, infectious, you know that. That is the acetaminophen, paracetamol. Then bacteria, throat swab collect करना पड़ता है. If throat swab bacteria, antibiotic. Without throat swab, the fever, the complication is throat swab. You go to the bacteria. Commonly bacteria usually occur. Then give it the antibiotic. Selection of antibiotics, short throat, गला व्यथा. Not coughing. शॉर्ट थ्रोट का कॉम्प्लिकेशन क्या देता है? हम शॉर्ट थ्रोट के कॉम्प्लिकेशन में एंटीबायोटिक देते हैं. क्या है? हु इज एंटीबायोटिक गिवन? ciprofloxacin 500 mg 2 times 7 days. Those are mentioned. I give write down 7 days. I take 2 3 days. After 4th day come. If symptom remove, then 1 day more. Short throat, gala व्यथा. That is the also epiglottitis, same treatment. Acetaminophen and if pain remain and antibiotic, ciprofloxacin. If not sensitive to ciprofloxacin. Now short throat, you know that. Now tonsillitis. If tonsil, there is the tonsillitis, infection of tonsillitis. What is the treatment? Same treatment. Paracetamol if fever, then 3 times, and tonsillitis, then ciprofloxacin 2 times 7 days. If not sensitive to ciprofloxacin. Now lower respiratory tract coughing. What is the treatment of coughing? Dry cough. If dry cough, that is the treatment is the antihistamine. If productive cough, the treatment is the auscultation of the lung area is bronchi present, not wheeze. Wheeze is the asthma. If trachea, wheeze found, that type of symptom produced by usually asthma, asthmatic patient. In case of asthmatic patient, the nebulization is the treatment of choice. But that is the coffee. That is the treatment. Bacteria usually occur by bacteria, not viral. Lung ausculted. If ausculted the lung, then you found that lower or upper respiratory infection, the treatment of choice, azithromycin. Azithromycin, 50S ribosomal subunit blocker. Bacterial ribosomal subunit blocker. In case of kidney patient, kidney failure patient, amic acid, 30S ribosomal blocker. Azithromycin, 1 dose 500 ml 3 days. Upper lower respiratory infection, lower respiratory infection. In upper lower respiratory tract infection 3 days. In lower respiratory infection 5 days. Azithromycin 500 mg. Understand? I think better understand. How you know the upper respiratory infection? That the trachea, you know that the upper part of the lungs. In case of lung, right lung, left lung, there is a lobe. In right lung, how much lobe? Upper lobe, middle lobe, lower lobe. In left lung, 2 lobe. Upper lobe, lower lobe. Understand? That is the treatment of choice. Now, my friend supporter, you know that what is the running nose treatment? Common cold treatment. Already say, in common cold treatment, paracetamol, before paracetamol and vitamin C, CB tablet. If you take to do not to tablet acetaminophen, then lemon juice, orange juice, pineapple, then pineapple. Vitamin C is the treatment of choice. Common cold usually 7 days cure. If not good, then go to the acetaminophen 3 times, 500 mg. Acetaminophen is paracetamol, 500 mg. Now we go to the ear, nose, ENT, ear, nose, throat. In case of eye, there is a common disease of eye, stye. What is the treatment of stye? Hot compression. Hot compression. Heat the area and compress that place. That is the treatment of choice. If not good, then antibiotic. If bacterial infection, then the antibiotic. Ciprofloxacin drop, eye drop. Fine, adult dose, ciprofloxacin. Now ear. In case of ear infection, outer ear, inner ear. Okay, fine. Outer ear, inner ear. If bacterial infection, then antibiotic. If viral infection, antiviral. If fungal infection, then antifungal infection, antifungals. Okay, fine. Sometimes fungal infection occur, you give the antibiotic. Furunculosis, bacterial or fungus? Fungus. Then furunculosis, see the pinna or outer ear. This okay, fine. Fungal infection. If fungal infection, then flufloxacin is treatment of choice. The common causes of ear, nose, throat, ENT. Okay, fine. Surgery branch. Second branch of surgery, ear, nose, throat. That is. Now maxillary sinusitis. In frontal sinusitis, ethmoidal sinusitis, ethmoidal sinus, frontal sinus, maxillary. Maxillary sinusitis is the common. The maxillary sinusitis treatment of choice, paracetamol and 3 dose. Shade antibiotic, amoxicillin. Amoxicillin is the treatment of choice. Amoxicillin 250 mg, 4 dose. If 5 mg, 500 mg, twice time, 7 days. Treatment of choice of maxillary sinusitis. Sinus problem. In frontal sinus, same. Headache, remain in frontal sinus. Now some word is a headache, migraine. The treatment of migraine, what is? The treatment of migraine, you know that what is the reason of migraine? If there is not ischemic or hemorrhagic stroke, how you understand ischemic or hemorrhagic stroke? By carotid pulse, there is a absence. You know that there is a carotid pulse absence, hemorrhagic or ischemic stroke. What hemorrhagic is more? Carotid pulse, asymmetry of carotid pulse, where occur left side or right side stroke occur. In case of migraine, that problem is not occur. Okay, fine. By that policy, you know that the migraine policy. Migraine policy treatment of choice, aspirin. Aspirin is the treatment of psoas migraine. Then sometimes that keep the pressure in the artery. What is that artery? Then the artery relaxation. Press that artery and constriction or relaxation. In migraine, constriction occur. Then give the, if constriction occur, take the arterial relaxation drug. हाँ ठीक है से those are migraine suffer more time. In case of eye case, those are use sunglass. That is not migraine. That by sunglass utilized, that is the headache. Correction the eye correction the diopter. How much diopter or convex lens power. Correct the lens power. That is the eye reason. Sometimes ear reason headache occur. Correct the ear. Sometimes nose reason headache occur. Correct the nose problem. Thank you very much, my parents supporter. Today is Anna from medical science class. I am representative of Dr. Mohammad Shoaib Choudhury. Thank you very much, my friend. If I do anything miss, see the main books, NT main book. Surgery, belly and lung. Understand? I think belly, that is my choice in surgery, belly and lung. In medical science, I read that book in diagram. Not whole book, just see the diagram. Then ENT main book. Thank you very much, my friend supporter. Today is Anna from medical science class.